Elevate track. And this track is meant for entrepreneurs, founders, startups, and investors. And this track will have day-long event, starting with the live pitch of startups, followed by boot camp by mentors. And then we follow it up with some showcasing some startups from our cohort one, as well as some featured startups, which have done some amazing thing in the health tech space. So it's going to be a great, exciting day. So stay on with this channel. This will stay live on YouTube and you'll get to see a lot of content. So just to talk a bit about Global Capital Summit, this is the 5th year of Global Capital Summit. It used to be an offsite event in Silicon Valley, one of the largest networking events for investors and entrepreneurs. With the COVID times, everybody is changing. So did GCS. Now we are online. And because we are online, we have gone global. And this year we have so many new features into the Global Capital Summit. We have an India track, which would start tomorrow or the PM time of West Coast. We have a special China track. And the best part is we have gone global, and today we will witness that in the pitching event, most of our startups came from across the world, be it Singapore, partly from UK, and we have someone coming in from Egypt, and of course, US is always there. So we have gone truly global, and you will see some very exciting presentations and interactions happening in a while now. So the way we going to move forward is we have distinguished panel of judges. We'll start with the self-introduction of judges. So I'll let them introduce themselves. Then Catherine, who has been working very hard to put together this event, she will step in and she'll brief you about the way the pitching event is going to go about. And then she will manage the rest of the things. Okay, let's start with Debbie. Debbie is one of our friends from F50 group. So I'll let Debbie start the judges introduction.
Sure.
Debbie?
Thank you very much, Pavan, for inviting me to be here. And I'm very pleased to see yet another group of great startups coming through F50, particularly with seeing them from around the world. I am venture partner with Pavan at F50. And one of the things that I bring to this particular kind of activity is an emphasis on marketing for early stage startups. So you can see my video that I did for Pavan for this event, marketing without in-person events. And I hope you take a look at it and get inspired. The fact that you're here is already a great sign. In addition to working with F50 and advising startups, I am getting off the ground a COVID-inspired nonprofit called the Health Grid Alliance, whose mission is to help heal the world, starting with COVID, using deep Silicon Valley technologies. A pleasure to meet you all.
Huh? Okay, fair enough. So let's, anybody, Sylvia, anybody, just.
Managing Partner, Silicon Valley Property Ventures. Greetings, everyone, and welcome. It's good to see you all here. In spite of our challenges, we have technology on our side. I'm a mentor with F50, been around for about a year. Been very pleased to participate in supporting startups in their journey. It's very exciting. And I wish you all well. You will see us throughout the conference, and looking forward to helping you bring your baby to life, launch and scale. Welcome and thank you.
Hi, I'm Barbara Higgins. I am an accountant, attorney, Olympian, and serial entrepreneur. And this time last year, I met Sylvia and the rest of F50 and became also a mentor, as well as the director of last year's cohort 1 for F50 Elevate. And you'll hear more from that group later on. I started and sold 6 different companies, all of which, except one, was funded and successful. So I've been where you are a number of times. And what I bring to the table is that knowledge of how do you get somebody's attention and make sure you keep them and they know what you're doing and they like your team and they're interested to hear more. Good luck.
Hello, everyone on the panel and all the startups and people in the audience. My name is John Ashley. I'm the entrepreneur in residence at Honeywell Lake Ventures, one of the co-hosts for the F50 Capital Summit. I'm the CEO of Dervina Inc. And I've spent 30 years in the as an entrepreneur in the medical device space with many successful startups. I really enjoy both the technology development and the company setup and the company development. I think they're both equally important to have a successful business. So good luck to everyone today.
John, you want to go next?
Sure. Hi, everyone. John Rashafi. I'm a mentor and partner at F50. Excited to be here today. Really interested in hearing what everyone has to say. I'm also a serial entrepreneur. I've been involved with 6 different startups myself, had 4 successful exits and a couple of not so successful exits. So I've seen both the good and the bad of startups and lived through both. So I think I bring some perspective that hopefully is valuable. I spent 25 plus years in enterprise software, mostly at places like IBM and Trend Micro. So I got dev tools and software in my background. And I'm also now a director at a not-for-profit entity called One America Works. That's one of my other projects that I'm working on right now. And what we do is we work with companies that are looking to diversify their workforce outside the coastal areas that are having so much challenges right now and into more of middle America locations. So that's a little bit about what I do and what I've done. Looking forward to hearing your presentations.
James.
Hi, everybody. James Sowers, F50 mentor, director of Greater Good Society and Forbes Top 50 Angel Investor. I'm looking forward to hearing everyone's pitch today and the rest of the summit. Thanks for having me, Pavan.
Great, thanks. Sudhir.
Yeah, hi, I'm Sudhir Kadam, venture partner at FIDA Growth Partners. Our portfolio companies are comprised of frontier tech startups. We focus on transforming startups from early adoption into growth. Some of our exits are in the areas of location apps, video streaming, IoT platform, and cloud workload protection, that is cybersecurity. Our current focus is on AR, VR, computer vision, IoT robotics, health and wellness tech, wearables, construction, teleoperations, and rejuvenation biotechnology. But we also welcome unconventional startups that don't fall into any of these categories. My role is to transform early stage startups to prepare them for growth through right go-to-market, differentiated value proposition, and aligning the growth trajectory to ready them to scale into thriving businesses and rewarding exits. I'm also an adjunct professor for entrepreneurship and innovation at San Jose State for professional MBA and EMBA programs. Thank you.
Thanks. Saeed?
Hi there. Hi, everybody. Good to see some very familiar faces and some that I've seen after quite some time post-COVID-19. My name is Saeed, and I am proud to be among the judges here and looking forward to some great pitches. What do? I am associated with F50 Elevate as a venture partner. I'm a CEO of a blockchain video distribution startup called Blockchain Video Services, and we are a seed-stage startup here based in the Valley. I am also a mentor at New Chip Accelerator and a deal team member at Sutton Capital, where I source deep tech startups. And I advise about 4 other startups in the Valley in my copious spare time. Great to be here and looking forward to some great pitches.
Okay, thank you. So the last to go is myself. I'm Pawan Kumar. I'm partner at F50 Elevate, the accelerator of F50 Group. And I'm also co-founder of 3PM Ventures. And I'm an ex-founder. I did 2 startups in the past. I'm an investor, and I'm also mentored a couple of companies. So I think all judges' introductions are done now. So I'll pass it on to Catherine, so we can start with the pitches.
Okay, great. Thank you, Pavan. So everyone, hi, welcome to this great demo event. We have 11 really famous judges here, and I'll be today's timer. So just let you know, as Pavan mentioned, you have 10 minutes in total, 5 minutes for a pitch and 5 minutes for Q&A. And I will be typing the chat box when the time pass by 5 minutes and 10 minutes. And so our first company is going to come is Fable Care. So when I call your name, please come up and unmute yourself and show your videos. And otherwise, please just keep muted and stop video. And so Fable Care, you can come up to the stage.
Hello, hi. Shall I
You can start
go ahead,
whenever
Sumit.
you're ready.
Okay. So thank you guys for inviting me today, and so great to meet all of you today. Before I start what Fable really does, I want to quickly get you on with a story. So meet Veer. He's a 35-year-old Indian living in Bombay, a working professional, works extremely hard from 9 a.m. to 9 p.m., 6 days a week. His work also involves frequent travel. He currently owns a motorcycle, and he's saving money to buy a car and a house. He has a family with 2 kids. And while he works extremely hard, he ensures that he spends quality time with his family and his friends. One day, while going up his office stairs, he feels exhausted and breathless. He goes and visits a doctor who tells him that he has hypertension and diabetes. The doctor tells him that he has to start changing his lifestyle, stick to a very strict adherence to medication, and also do exercise on a regular basis. Veer and his family are in shock, but slowly and steadily the situation sinks in, and Veer starts taking care of himself, and he starts sticking to the doctor's advice. And in a few months, he is okay and back on track. Unfortunately, life goes on, and he slips back to the 9 a.m. to 9 p.m., 6 days a week work schedule, starts traveling frequently for his work, and he misses his medication quite often. He also skips meeting his doctor on time. And slowly and steadily, little does he know that his metrics, his health vitals, are not tracking accurately and as per the doctor's advice. Slowly, he slips into a cardiovascular ailment from his hypertension and diabetes. And now he has to be hospitalized more often than ever before. And all the money that he saved for his family and buying a car and a house goes into covering for his medical expenses. Unfortunately, Veer succumbs to his ailment in a few years and dies because of some of these ailments. This is not a cooked up story. This is the story of my life. This is my dad and me a few years before he passed away. He faced these same challenges that I just recounted. Unfortunately, this is not just the story of me and my family. This is the exact story of many Indians who go through the same problem every day. And I have seen this up close and personal because I come from a typically called bottom of the pyramid family. And I've seen this happening many a times across my family, as well as many others that used to live around me. Fable Care started as one of the care systems which allows such people to manage their medication schedules and adhere to the treatment plan and be able to follow their diet and the treatment advice given by the doctor. We are a Singapore incorporated company and have been active for the last 18 months and have impacted many lives. The problems that the Indian healthcare sector really faces today is, and I think a lot of these problems have been personified a lot more during the COVID times, is that among the chronic disease patients, adherence to treatment plan is very low. Doctors have very limited time. There is little or no digitization across the entire value chain. And there is no single ecosystem which takes care of all patient needs and all doctors' need under a single window system. And that is exactly where Fable steps in. We help the doctors manage their regular visits and also drive patient outcomes and drive healthcare outcomes for the patients. We also help insurance companies lower their claims and risk and be able to operate at a much higher cost effectiveness. We also help a lot of other tertiary companies who are involved in the healthcare of these patients by providing more holistic solutions to the patients, and also to drug companies that brings a lot of dollars because we ensure that their patients are taking their medicines on time. We have two apps. On the patient side is a health assistant to the patient, and on the doctor side it is a decision support system. A typical user journey starts when the patient visits the doctor. The doctor simply takes a photo of the prescription and uploads it on the app. Today, the doctors, this is a slightly older demo, but today the doctors can also issue an e-prescription directly from the Fable app. Once the prescription is ingested onto Fable, it gets immediately digitized by our cutting edge technology, and the patient starts following all the treatment elements of a plan. Typically, a chronic disease patient has 4 treatment elements, including adherence to medication, to lifestyle elements such as diet and exercise, to testing schedules, which is home-based or lab-based testing, and the review period given by the doctor. And these all come in a daily diary format for the patient to follow. They get alerts and reminders on various tasks and activities that they have to do. Fable has also built one of the largest ecosystem of connected devices in India. And we have more than 17 connected devices from where the data comes back to Fable automatically. This also means that there is very small amount of misreporting of data. And we have also obviously made data for self-reporting of data by the patients as well. Based on the longitudinal as well as static data coming from prescriptions and discharge summaries and longitudinal data coming from devices, Fable is able to give very highly contextualized and very precise guidance to patients in terms of what do they need to do on a day-to-day basis to manage their health. This is so precise that it is also takes into account what kind of medications you are on to help you overcome the side effects of those medications. Patients are able to also manage and see how their entire health stack and metrics are tracking. The entire platform is gamified so that you also get points for every activity that you do on the system. Based on the data, this is how the doctor's entire database is segregated into buckets of red, amber, and green, where red bucketed are those patients who are predicted not to do well over the next 1 month. Amber are those who are predicted to be on borderline, and green are predicted to be on predicted to do well. And based on this kind of bucketing system, the doctor can immediately intervene with the patients, asking them to come back to the clinic, even changing the prescription or giving them a big thumbs up. Now, this has a very large impact on the patient's treatment outcome because it improves the adherence from 24-25%. On our patient base, the average adherence is today 89%, which is very high adherence rate. In addition to that, we have already saved more than 100 lives in India by helping doctors get to patients much faster and much earlier than an emergency care scenario. We have also helped a lot of women who are undergoing IVF procedure to not only conceive, but also deliver healthy babies. We have been highly focused on diabetes and hypertension. And today we cover 9 ailments, but most of these ailments are largely comorbid conditions emerging out of hypertension and diabetes. We are today the market leaders in hypertension management in India. In India, about 350 million people suffer from hypertension, diabetes, and similar chronic diseases. And this is a $70 billion market in India, where $100 billion out-of-pocket spend happens in India. We are extremely well poised to capture this market and be the market leader because we are extremely unique in terms of complete disease management as well as a medical platform. We are 2 founders, I and Mukesh. Both of us have about 12 years of work experience in working with large-scale ERP, SAP kind of technologies, and we have done a lot of work on implementing them. I have had a previous startup which sold for $8 million in 8 months' time. And that is, that also put some money where I have put my initial capital into starting Fable Care as well. We have a great bunch of advisors on the medical panel, and we have a great bunch of advisors even from Google and some of the billion-dollar companies in India who are helping us on our advisory as well as our business and strategy. We are funded by two of the US-based funds called SOSV. They are the third largest accelerator we see in the world, and Fresco Capital, which is a US plus Hong Kong-based venture capital fund. We are a very large ecosystem of players where insurance companies, hospitals, patient care services, doctors, devices, and drug manufacturers all come together to give better care to the patients. And we are also working now with the government directly to impact patient outcomes in India. These are our ecosystem partners. And you can see that this is a very large ecosystem that in 18 months we have been able to develop and also deliver patient outcomes through. We recently launched one of the largest diabetes care management programs in India in collaboration with Roche, and we are an exclusive partner to them. This happened on 15 June. And on 1st July, we are launching India's largest hypertension management program in collaboration with Omron. Our patient growth has been extremely well. We are hyperscaling for the last 2 months. Even during COVID times, we have been growing extremely fast, nearly 100% quarter on quarter. And we have customers love us because we have 66% retention in 12 weeks time, and our adherence scores are through the roof.
Hi, Sumit. Sorry to say that, but you're already 10 minutes. So
okay,
I have to
I'm
cut
finishing
you right here.
in 1 minute.
Pavan,
okay, go ahead. Go ahead. Finish it up.
Yeah.
Okay.
So I have about $100,000 monthly GMV, and we are again growing 100% month on month. We have recently closed our pre-series A of $1 million with SOSV and Fresco, where SOSV doubled down on our next round. And we are currently raising $8 million, where $4 million is already committed by Fresco, Social Starts, and Omron. All three of them are US and Japan-based investors. Thank you so much. Open for any questions that you have. Apologies for running a bit overboard on the time.
Yeah, we need to skip your Q&A. So, I mean, we hope we'll share your email ID with the judges.
Sure.
If they want to get in touch with you. Thanks, Sumit.
Thank you.
Catherine, let's go on.
Yeah, just to make sure everyone understands, you get like 10 minutes in total. So if you have if you pitch more than 5 minutes, though, then you don't get really Q&A. And next one is Pharma School. Pharma School, you can come and share your screen.
Yeah, so sorry guys, we need to really keep this time because we have a schedule that kicks off at 11 o'clock. So. We cannot hear you, Ramesh.
Hello, Sahil, are you there?
Yeah,
Sahil will be starting from our side.
Sure, please let me know if you can see the screen.
Yeah, we can see the screen. Go ahead.
Okay, thank you. So good morning, good afternoon, good evening, everyone. So this is Sahil here. So we are representing Pharma School today. So I'll just give you a brief introduction to the firm. So first of all, Pharma School is a market research firm into pharmaceutical and healthcare space. So briefly talking about our area of operations. So we are currently offering syndicated and customized market research into pharmaceutical space, wherein we work around various analytics around disease landscaping, around competitive assessment, around basically performing epidemiology exercises, as well as working on various ad hoc analysis, which can be like related to basically related to life cycle maximization or whatever the pharmaceutical companies need in terms of the research while they are actually working on the products in the different stages of life cycle. So we have been offering those kind of services. So this company is formed by me and Ramesh. So we are both are there on the call. So I am an ISP graduate by background and MBA. And I have over 10 years of experience primarily working into insights and analytics space and product management space across the industries. Ramesh comes with a pharmacy background and an MBA with 13 plus years of experience into market research and consulting space, having worked with companies like Novartis, Allword Health, including GSK as well. So, I mean, so this is how we started the firm. So we were offering market research services based on the secondary sources and the information which is coming from that. Now, as we actually worked on various secondary sources to get the information, we realized that first of all, secondary doesn't cover the entire aspect of getting the information. Secondly, there is a need of patient and physician insights which need to come into various research elements. So I mean, for that, we explored one more additional resource to get the information, which is around social media conversations which are happening. So what we see is for all the chronic disease indications which we cater to in terms of research and consulting, the patients as well as physicians, so mostly patients are pretty active on the social media channels as well as on various patient forums. And these channels are currently untapped specifically in pharmaceutical space because a lot of scientific conversations happen there. So we can actually tap those conversations, we can extract those information and build various KPIs out of that. So what we have done is we have developed a platform for which the POC or the proof of concept for asthma indication is already completed. In this particular platform, we get the information from various sources. So we have developed our own web crawlers to get the information based on certain set of keywords. So we have a medical ontology being created by us. I mean, we have created a medical dictionary for asthma of around 8,000 keywords. Based on that, we have pulled out the conversations from various social media channels. We have developed basically a process of removing noise. So we have defined certain set of business rules to remove the noise out of these conversations. And then we have developed a machine learning or AI-based algorithm to actually categorize those information into various categories and various themes of discussions. And finally, based on that, we have actually identified certain set of KPIs as well. And then we have visualized those set of KPIs into in a form of a dashboard, which can be actually shared or which can be actually offered at a subscription to the pharmaceutical firms on a yearly basis. So right now, we have actually done a POC for asthma, and we believe that this kind of dashboard can be offered to the firms at an annual subscription price of close to around 40 to 50,000 USD per year. This is based on the competitive benchmarking because there have been some players in the market which are offering social media services, but they are referring to the part of the ecosystem. Either they are only pulling the conversations or they are working on the text analytics from the conversations which are already coming in. So what we offer as a differentiated service here is that we are an end-to-end platform which starts from conversation pulling to the categorization or cleaning of the data and then categorization of the information and then coming out with the KPIs as well. So that is the thing which we are offering. In terms of our traction, so what we have done till now is we have actually based on our research services which we have done since past 2.5 years. So we did a revenue of around $50,000 last year, 2019-20 financial year, and we have serviced around 13 plus clients. So we are socially very active in terms of like we have LinkedIn channels, we have Twitter page as well as the Facebook pages. So we have patients, physician as well as company associates connected there. We keep on posting the content. So we have 1,000 plus followers there. And we have a very robust leads base as well in terms of actually seeing how the potential future business looks like. In terms of the future growth potential, so this is what our projections look like. This is primarily basis we expect an exponential growth in our business. So because we are offering a service which is first in the industry, so we will be the first player to offer an end-to-end social media analytics platform along with the secondary media services which we are already offering. So we plan to expand outside India as well in terms of setting up our operations outside India in US in next couple of years time frame. So that's where actually we will be looking at expansion as well. So we are looking at a $500K to $1 million kind of an investment right now. We are right now completely fully owned in terms of we have not basically taken any investment till now. So, and the funds will be utilized in terms of setting up the database platform as well as setting up the manpower for that database as well as for other operations as well. We plan to offer an exit in a couple of years time frame when we raise another round of funding while we launch our international operations going forward. So this is a pitch from our side. I'm happy to take any questions.
Yeah, this is Saeed. Can I ask a question? What I don't understand is how do you deliver your value proposition to the customer? What's the vehicle? Is this an app? Is this a desktop platform based app or
So
services?
Sure, Said. So currently what we are doing is, since we are offering market research services, so mostly it's a one-to-one interaction which happens with the client. So mostly we're working on ad hoc projects and a project basis. So that is mostly in the form of presentation, which we actually deliver. But right now, if I may take a liberty to show the dashboard, which is a POC. If you let me know if you can share if you can see the screen in terms of the dashboard which you have created for POC as well. So this is finally, this will be the platform which will be actually showing to the or referring to the customers as well while we go forward. Let me know if you are able to see the dashboard.
No, I can't. I can't.
Okay. So let me share that. Can you see it now?
Yes, we can see it, Sahil, now. I think everyone would be able to see.
Right. So, I mean, this is the dashboard which we have created. So this will be updated on a real-time basis. I mean, there is no manual intervention here, starting from pulling the conversations to categorizing them into various themes to noise reduction and finally coming up with the KPIs. So these are some of the KPIs which we are tracking. So one is like the monthly trend of conversations which are happening. What are the key channels where the conversations are happening? What are the different categories? The geographies, the patients by age group who are actually having those discussions. So this is specifically for asthma indication. What are the sentiments and what are the key hashtags being used? So this is an executive summary. Then talking about the treatment insights. So what are the preference shares of the various treatments? So this is very important parameter which companies actually right now track based on the primary market research information, which is a costly medium as well as the sample size is very less. So I mean, that's where this is a real-time platform which can track the shares of the drugs on a real-time basis. Then what are the various preferences which the patients take while selecting a drug? What are the typical side effects? Then talking about the source of business, where is the business coming from? What are the reasons for those switches happening if the business is coming to you? Then a very important part is the patient journey. I mean, this is an important chart which I would like to display. So basically, this displays that from triggers to the symptoms to finally the diagnostic tests and finally the molecules which the patients are taking up and where are the switches happening and what are the reasons for those switches. So if you take up any line or if you take up any particular line in this, so that indicates that possibly a patient who was on omalizumab had gone for an IgE testing and finally he has shifted to Xolair. So this patient journey will be more robust as we take this platform live. I mean, and we get millions of conversations flowing into the channel right now. So this actually displays a typical patient journey. And there are different elements of the patient journey which the companies can look at based on their own interest as well as their own drug. So I mean that's where actually this type of patient journey can be very well created from the social media interactions.
How do you manage the bias between a marketing business versus a scientifically authenticated business, which is critical in the medical industry?
Right. So, I mean, all these conversations which we are taking right now, 90% of them are patient conversations wherein they actually maintain the patient diaries and they talk about the various symptoms which they are experiencing. And most of these symptoms are actually being highlighted after they have a discussion with either the HCPs or basically they experience kind of symptoms. So basically, all these are happening in terms of the scientific medical conversations.
I have a question. The 13 customers that you already have they paid? How much have they paid?
So we have a revenue of $50,000 last year, and this is based on our market research services. For social media platform, we haven't made it live yet. So we are actually taking it live. So we have done a POC, but for these 13 plus customers, this revenue is coming from. So every project right now, what is our business model is that we typically charge $1,500 per week for our research services. And based on the alignment on the time and duration of the project, we define the pricing of that particular project. So the typical ticket size of a project ranges between 4,000 to 5,000 USD approximately. So based on that, we actually define the services. But with this platform, we will be able to do two things. First of all, offer this as a subscription wherein they can utilize this platform. Second is take up a lot of consulting projects, because now we have an additional data source at hand, which a lot of companies are not catering to right now. A lot of research providers are not catering to.
Okay, thank you, Sahi. Thank you for your sharing with us.
Thank you.
Yeah. And the next one we're having is MovieTo. Please come up.
Hi, good morning, good evening, good afternoon, everyone. Let me just very quickly start by sharing my screen.
So this startup is one exception where we have an edutech startup. So I mean, this is one which has seen a lot of interest during COVID times. That's the reason why I brought this into the teaching session.
So thank you, Pawan. It's a very simple problem statement that we're trying to solve here. As we are aware, it's a global problem that every year there are millions of students who graduate, but however, very few of them are employable. So keeping that particular aspect in mind, I'm not going to spend a lot of time on what the problem statement is, but rather what kind of opportunity it has created for us during the COVID time and how we have leveraged opportunity. As a company, we decided to focus only on offering, so as a company, what we're trying to do, we are a managed marketplace. We are not a training company. What we essentially do is we aggregate various kind of certification partners, content providers, industry expert, projects, internship opportunities, job opportunities, and offer it as a bundle package to the student community. Our key focus area at this point in time are K-12 to K-16 students, which are essentially our undergrad engineering students here in India. What we're essentially doing here is focusing on, bridging this particular gap for emerging technologies or other technologies which are in high demand. Because our eventual goal here is how do we make them employable at the end of our product offering that we offer to the students. So a couple of areas that we are focusing on, I've already mentioned it in my screen. How it works, it is a complete ecosystem that we've built here, like I mentioned. So we are a platform, we are an interface between the various service providers, and we offer it as a bundle package to the student community at a very affordable price. So each of our product offering just costs them about $100, and it is a 2-month-long engagement that we have with them. So right from the LMS, the learning management system, to the e-learning content or self-paced learning content, to having those live interactive sessions or webinars or seminars with the student community, all of these are done online. Along with the analytics built into the entire system allows us to track the students' performance and also see and assess how they're performing and how are they coping up with the training or the industry training that we are delivering to the students. I mean, these are a couple of our offerings that we offer to them. One more thing that we realized is essential, and is something that we keep hearing from the hiring managers, is the ability to communicate well with the team and also with the clients. So this is another additional feature that we've added up. It is a very, very fragmented, a very unstructured market here in India, and I think it's globally also. How we are looking at differentiating ourselves from other companies which are essentially more or less training companies or just placement companies, is that we have a very focused approach. We are only focusing on, like I said, K-12 to K-16. It is a one-step solution. The student does not need to go to multiple platforms to avail solutions or offerings that they're looking at. It's value for money. We are playing a volume business here, so we deliberately kept the pricing very, very low so that more and more number of students could avail this facility. In addition to that, we also offer personalized mentorship. We have tie-ups with 200 plus companies who are now willing to offer those job opportunities through our platform. And we're not just a listing platform. We are actually, like I said, we are an interface, and we offer customized solution, or like I said, we are a managed marketplace offering customized solution to the student community. There are tailor-made modules, and we also have expert here with us. Now, when you look at it from an industry partnership point of view, we have mass recruiters, we have product companies, and we also have a lot of core companies. In terms of progress, this is the progress that we've made. We launched this particular product on 1st of April 2020 this year. By May 2020, we had 700 plus students who had enrolled with us for our program, and we launched a first batch on 6th of May 2020 this year. By June 2020, while we're still on 15th of June, we have multiple college partnerships. We have also launched a second batch, and we have also geared up for our job guarantee program. We see a very, very positive response, both from the industry point of view as well as from the student point of view. And we're hoping it to be a roaring success, and we're looking at launching it from July 2020. And for the month of August and September, we're looking at ramping up our sales to 10x. Like I've mentioned below, that we've already completed 1,700 plus sales. We have 200 plus corporate types who are willing to offer 300 plus job opportunities through our platform. And we have 10 plus college associations and 10 plus certification partners also. In terms of traction, in the first month itself, we saw decent revenue. I wouldn't say great revenue, but we are happy considering that we started from zero. So we closed $27,000 worth business in the month of April. In the month of May, we've closed business worth $32,000. And for the month of June, we are sitting at 13,000 plus, $13,000 business. And we're looking at the projected revenue again. We're looking at reaching it to, again, $32,000 business. And for the month of July, I've put it as 40,000. That's a very conservative number. But of course, we're looking at that number also going up. In terms of a revenue model, given the fact that we've been working with the student, I and my team members, and our various job role capacities have worked with the student community very closely. I've worked with the student community for the last, 3+ years, and we understand how the K-12 to K-16 student operates. We understand how do you, get into that particular mindset and how do you drive sales there. So there are multiple revenue models that we have. I would say that we are really, really strong at cracking the B2C model, and that too organically. In fact, if you look at our CAC, our per customer acquisition cost is just $3, and we charge about $100 per program that we charge $100 per student. We also have, we also saw a great deal of interest from the college and the corporates both. The corporate is willing to pay us money, a recruitment agency fee, and so is the college willing to pay us, the industry learning training association. In addition to that, owing to the fact that we work extensively with the student community, there are other multiple marketing opportunities that have come up for us. We have 2 clients who signed up with us to, drive their businesses through the campus ambassador, pool that we have with us. In terms of an investment requirement, we're looking at raising $1 million. This is how we're looking at, investing this money. So 25% of it would be spent on product development. We're looking at building 2 platforms. One is, of course, the student dashboard, which I feel is very, very essential from both a mapping of, what kind of progress have they made, and can I map them with the, corporate requirement. And also we're looking at building our campus ambassador platform. We're also looking at investing, 30% of it on sales and marketing activities, because for the month of August and September, we are looking at getting at least 10,000 plus students to come and take up our program, which by the way is achievable. So which means that we'll have to ramp up on the resource also, the number of resources that we will require. Also, we realize one more thing, that if we have to scale business, the content will have to be self-paced content, and buying content from external third-party sources does eat into our revenue. So we are looking at also developing or building our own content, and that's why I have allocated 15% of the budget for that particular thing. And we're also looking at offering seamless experience to our end user. So I have allocated, and there are certain certifications, etc., that we need to buy, which makes it more lucrative, types with foreign universities, etc. That also costs us money. So I'm looking at allocating that budget, towards the operation cost or the OPEX cost. Talking about myself, I have done my BPM course from Pharma School of Business. I have worked at IBM and have been a part of mergers and acquisition team. And besides that, I have also worked with various, startups. I was heading business for Nestaway, and I've been a part of their growth journey from the time that they raised, that they had 250 customers to the point in time that they had 35,000 customers. So I do come with a lot of experience in terms of driving the business. And B2C is our B2C and B2B, both of them are our core strength areas, and we know how to keep our CACs low and and still be able to generate a better ROI on our business. So I am open to questions now. I hope I am on time.
Yeah, hi, this is Saeed. I have a question. What's the overall addressable market in the geo that you're in right now for this business?
Sure. So every year, Saeed, there are about, there are 2 million students who are graduating out of an engineering college every year, who are graduating out of various engineering colleges here in India. And I have not taken into consideration the polytechnic or the diploma students. So if I look at the overall opportunity that we're talking about, it is definitely, it runs into at least 10 million students that graduate every year, both in tech and non-tech courses programs.
What's the lifetime value of your B2C customer?
Sure. So what we've seen is, of course, typically what we're looking at in terms of LTV, we have students who come with us for 2 months, and then they, go on to, so you can't become an expert, or you can't become, I would say in 2 months time, you only understand the fundamental, knowledge. So we have seen students migrating to and taking up the next level of program or the intermediate level of program. So typically we're looking at anywhere, from 4 to 6 months as the LTV for our students.
And is this a subscription-based business, or is this a one-time fee? Or
it's a one-time fee. We are looking at moving it to subscription-based also.
Okay, thank you.
Yeah.
Suggestion. Have you considered working with the colleges to create accelerator programs?
Yes, we are doing that actually. I am in advanced discussions with 3 big universities, and they are very keen to take up our program. The only reason being that we have a huge pool of corporates that are willing to take up students from us. Now, just to give you some numbers, some stats, companies like Infosys and all, they spend about 14 lakh rupees. I mean, if I have to convert that into dollar, that would be roughly around, 7 and 7. Almost about 20,000, 20,000 USD on just making a student employable. That's a huge cost to company.
That is a huge cost.
Yeah. So with our program, what we are trying to do here is, I'm saying that you don't spend a penny on, getting these students employable. I will do that for you. You don't pay me money, but I'm going to charge money either from the college or from the student, and I'm going to give you an employable student. So that seems to be resonating. Yeah, resonating really, really well with the corporates. You not believe that in last 3 days we have gotten more than 200 job requirements. We have those JDs sitting with us, and they're looking at hiring students from us. And so we see a very, very good response from them. Yeah.
Good.
Yep.
Thank you.
So anyone else want to ask a question?
Is the enrollment like on a rolling basis? Because I saw it was half the revenue in June, but I was guessing because we're only halfway through June. So can you enroll like any day of the month, or is there only certain days?
Sorry, I couldn't get your question. So you're saying you saw half of the revenue for the month of June?
We're in June 15th.
Right, but I was assuming we're halfway through the month, so that means people could enroll any day of the month if they wanted. It's not like you can only enroll the first day of the month, the 5th day of the month, or the last day of the month. It's like a rolling basis, the enrollment.
No, so we have students who pay us in advance, and then we launch our batches twice in a month. So we have certain days that we fix that, okay, you'll be able to join this program from this particular day. So we have, because all of our sessions are instructor led. For self-paced, self-paced content or self-paced trainings, they can take it from any day. But if they want instructor-led sessions, then they typically start from the first week of that particular month, and then the second week of that particular month. So typically on 6th and 15th of every month, we launch our batches.
Okay, fair enough. I think we passed the time. Thanks, Mridula.
Thank you.
Kathleen, who's next?
Next is Allword Health. Allword Health.
Yes.
Yeah.
Guys, just a request to the remaining startups. We need to engage judges also. So just make your presentations short so that they can interact with you. So just talk about core of your product, bit of traction, and let's let they too have some interaction with you.
Sure. Can you see my slide deck?
Yeah, we can see that. Go ahead.
Hi, my name is Dinesh Koka from Allword Health. We're primarily a cancer analytics platform. The problem that we're trying to address is 50% of all cancer patients receive treatments which don't work for them. And this is not unique to a certain geography. India adds about 1.5 million. The US adds, something similar or even more, right? And just to give you an example, like I said, it's not unique to India. For example, a hypothetical patient, Suzanne, the data is, actually underwent delay in her treatment of actually getting cancer treatment because her cancer treatment decision got delayed because there were not enough pathologists to report on her biopsy test and give the report in a timely manner. And the data, this example is from a real live case that happened in the UK, where we actually have shortage in the number of pathologists. And the same is true of countries like India as well, which is what we are trying to address. And cancer pathology is an important part which contributes a lot of information which goes in towards deciding how to treat a patient. But the challenge is it looks something like this, right? This is not the way, but this is what it looks like if a pathologist looks at a biopsy slide through a microscope, because it's as good as looking at the city, the map of a city, and trying to count for certain types of colored cars going in a certain direction, and that leads to the challenge in terms of inconsistent expertise. So if you have to convert that into the number of tests or number of cases are growing, and number of cancer tests are growing at about 24% every year, whereas we are not adding as many pathologists to keep up with the number of tests, leading to huge waiting lines. Two, there is a training angle. Pathologists need to keep up abreast with the newer biomarkers being discovered, so pathologists need to constantly undergo training, and that introduces a variation. And clearly, the kind of prognostication tools, what we discovered, meaning the type of tools that cancer treatment oncologists use, that they use even in India, are still based on Western population data, right? So how can we build more accurate prognostication tools which can give the suggestion on using the accurate cancer treatment, right? So what we are building is a cancer prognostics platform. The underlying technology is computer vision and machine learning based techniques, which we use to build automated diagnostic tools, which can help histopathologists or cancer pathologists, and also treatment decision support tools, which can be used by treating oncologists. How we do this? We do this by mapping it against the cancer treatment workflow, and we build individual products which are relevant in the cancer treatment workflow. The biggest area of focus for us is what you see here, which is the Telepath DX plus Path Assist, which is our product vertical in cancer pathology. Like I said, because cancer pathology delivers the maximum amount of information which goes into deciding how to treat a patient. What we are building within the cancer pathology space is a full stack solution where the bottom layer is a pathology workflow solution called Telepath DX, which helps labs and providers to leverage their digital pathology network and primarily get benefits, optimization out of their reporting network, and also enable a hub and spoke model where the pathologist at the hub or the lab is able to connect to the remote labs and provide better access to quality diagnostic reporting services. And on top of that, we are enabling the AI tools that we are building. Our core focus is building these computational tools, which looks at the biopsy slide and helps pathologists do their job faster and with higher accuracy. So for example, the reason we are confident about this is because we build these in collaboration with leading cancer institutes. And the way we are deploying this is the Path Assist analytical tools can be used by the pathologist with very little change to their reporting workflow today. We focus on two ways in which we build the analytical tools. The box here, the purple box, is AI tools in existing set of tests like Pap smear, which is used for cervical cancer screening, reading a biopsy slide, which is your normal tumor tissue, and also IHCs, right? HER2 is a biomarker for breast cancer, PD-L1 is a biomarker for lung cancer. So here we are building tests which can help the pathologist process that slide and do their job faster and with higher accuracy. In addition, we are also building analytical tools in areas which are newer, which are not being done by the pathologist today, what is called tumor microenvironment analysis, help them uncover newer information, which actually could help them take much better treatment decisions or much better prognostication, right? This is just an example. I would have loved to show you a demo, but this is an example of what the AI output looks like. On the left side is your HER2 slide, what is being fed to the AI. On the right side is what the AI gives, clearly identifying which are those cells of interest for the pathologist. This is the traction that we have. We are a pre-revenue startup right now, but we've just converted one of the largest diagnostic networks, which is, they are going to use our pathology workflow solution, connecting 25 of their centers, and they plan to expand this to 100 centers across the country. From the AI collaborations, all our AI tools are built in clinical collaborations. We have 8 partnerships, out of which we've brought 3 tools which are in mature phase and undergoing clinical validation. We have another 4 in the pipeline, through which we have clearly, each of these tools we have identified, we've demonstrated the results. And this is not this is not a place that is, we are the only people, but where we are unique is we have the clinical collaborations combined with our domain expertise that we have also in the unique tools and IP, intellectual property that we built in terms of building these AI tools. Those are, that's where it sets us apart. It's a $12 billion market. We expect to deploy these in the form of a subscription model. And we are already in talks with healthcare providers who are interested in using these tools, who are also helping us in validating these tools in the actual usage in their reporting workflow. We've raised about $600,000 till date. We're raising about $2 million right now, primarily helping us complete our clinical validation processes faster and also start early commercialization of our AI. We've already started commercialization of the pathology workflow solution. The capital will primarily go into accelerating the commercialization of the AI platform. I worked in the healthcare space for about 18 years. I used to be with G Healthcare. And I used to run my last role. I used to run a $60 million P&L, managing a certain region of India. My co-founder, Vikas, he's based out of San Jose. He has a PhD in signal processing and has worked in the AI space for about 14 years and has patents in his name, has worked with the likes of NVIDIA, Qualcomm, Roche. And we have a senior pathologist who was our chief medical officer, directing our strategy. And we've put together a group of advisors who help us, clearly provide the direction and also validate the tools that we build, and also validating the direction in which we are building our clinical strategy. Courtesy of having worked in this space, obviously we have a few partners who help us make progress in our journey. And we've been lucky enough to get some recognitions for the kind of technology and the products that we build. Thank you for your time. Happy to take your questions.
I have a question. Are there any considerations with the FDA in what you're doing?
Yes. So currently our focus for the US market is only out of the clinical collaboration that we have existing with the Yale School of Medicine as of now. We see from a US market standpoint, we see us entering the US market in about 18 months time. From an FDA standpoint, there is an approval process, which is what we will use this time to go through that. We are doing our clinical validations in India with cancer institutes. We already have some data coming out of our initial validation studies. We are taking them through a second level validation blinded studies within India, which will help us publish the initial set of results for each of these tools. For FDA, for the US market, the FDA process is, we would want to raise a subsequent round, which will actually help us complete those validation studies within the US as well.
Great. That's very helpful.
Thank you.
So you had this tie-up with several path lab centers in India. What is your revenue from that? What is your current revenue?
We were pre-revenue. We've just got our first implementation coming up with one of the largest diagnostic networks. It's a subscription model. They use it for more as a hub and spoke model or a telepathology platform. There, our subscription revenue is on an average, subscription revenue is about $2,000 per month per customer. The value that they are getting is connecting their hubs or senior pathologists to their junior pathologists and the spokes across the country.
So it's
not we don't deploy the AI on the.
So it's not for your core technology that you're talking about.
Yes, yeah. No, it's just the workflow solution.
And what is the readiness?
We expect to deploy the AI on top of this network.
So what is the readiness of that?
The AI tools. So we have three AI tools which are in mature phase, and we validated them. Now they are undergoing clinical validations in blinded studies, which will give us data that we can actually publish. And from a regulatory standpoint, that'll give us, we can actually start selling them as a commercial tool, which we expect to complete that in the next 6 to 9 months.
What does Dr. Lara feel is your biggest obstacle getting the pathologists to have confidence?
Yeah, so she's the main thing that she helps us in is about matching what we are building from a AI tool perspective to match it as close as possible to what is the actual lab workflow, right? We are asking them to move to a digital workflow, whereas they are more comfortable reporting on the microscope, whereas here AI only works on a digital image. One, two, the second thing that she's helping us do is how does mimic what a pathologist does, right? An AI can look at the entire slide and give some results, but pathologists don't work that way. They go in certain fields of view, right? They don't actually look at the entire slide. They look at maybe 10 fields of view for certain cases, 50 fields of view. That's the main thing in terms of matching what a pathologist go through when they report. From an adoption standpoint, we've actually seen fairly good consistent response between different pathology as well as pathology labs in terms of the potential of what they see that the tool can do for them. There's a lot of waiting time. There's a lot of cases waiting to be reported at the start of every day. The promise of the tool in terms of helping them get more productivity out of their existing set of resources. So we actually see them being enthusiastic about it. But the delta, we are primarily about bridging this delta about how does a pathologist work and exactly how can we match what the AI does for them.
What's the competitive landscape there in your geography?
In our geography, the biggest set of players are more, there used to be hardware players who are also building AI on top of it. We decided not to go for hardware in our full stack. There are a few players. There are a lot of academic teams which are building tools, but not in a commercial setup. There are a few startups in terms of the histopathology AI. The kind of papers that we've presented, the results that we've shown, we've built a unique position for ourselves. But healthcare AI, within the geography, there are quite a few healthcare AI companies. If you take, there is SigTuple, which is more on hematology. They do blood, urine, and serum based. They don't do tissue based. There is Niramai, again a healthcare AI, but more a thermal screening company for breast cancer, not necessarily in tissue, right? Where we try to be different is we just stayed focused.
Are you familiar with a company called Page AI?
There is Page AI out of MSK, incubated at MSK. There is Path AI out of Boston. Yes, so we follow their work a lot, and we've had the opportunity to, talk to partners even in the US who have seen these players as well. The feedback that we get is the kind of work that we've built, the demo that we are able to show in live, how the tools work. We've got very good feedback in terms of both the results as well as the direction in which we are building these tools. Clearly, obviously, Path, the kind of capital that they've been able to deploy, obviously they're able to accelerate their work and work at a much faster pace. But where we are trying to differentiate is building more robust AI, because not all data is going to be digital, meaning whole slide images or the digital slides. Apart from the US and the rest of the world, not everybody is going to have access to these pristine images or digital images coming out of a digital scanner. So we are building more robust AI because our models are looking at not just these pristine whole slide gigabit images, but we're also feeding them, all of these different types of images which are going to come from different optical sources of capture, meaning cameras which capture the image of a slide. And that's where our ability to accelerate our learning and train our models faster on the varied types of data will help us stay ahead, is what we feel.
Yeah, Dinesh, we need to stop you now. So thank you. So Catherine, let's move on.
Thank you.
Thanks, Dinesh.
Okay, so the next one is Ratcliffe. Ratcliffe, yeah.
Hey, hi, everyone. This is Ashish Dubey.
Go ahead, Ashish.
Let me just, yeah. Hope all of you can see this.
Yeah, we can. Go ahead.
Okay. Well, hi. Ratcliffe Life Sciences is a Delhi-based startup. So we started 2 years back in 2018, and we are basically a genomics and life sciences-based research diagnostic setup, where we are trying to establish a network of mother and child and oncology setups, where we are primarily dealing with the diagnostics of really specialized cases, which is dealt into genomic segments, so DNA-based diagnostics. Our offerings are mostly into the mother and child and oncology till date, and recently we have evolved to the rare diseases, which has arrived from the mother and child, of course. The vision for the company is to make a impact in the segment by offering comprehensive packages into mother and child and oncology segments. Mother and child itself is a very big volume business in India today. 25 to 27 million deliveries, 25,000 gynecologists, and a couple of thousands fetal medicine and genetic experts. Making this business more lucrative and more affordable. Having all these specialization in the bag, we have been offering various panels and various testings, which is very highly specialized, like NIPT, clinical exam, the ones which is not a regular diagnostics basically. So molecular biology in the back. With a very specialized team, in the back, we have advanced level of biosciences, product development, and efficient operations. A very strong ecosystems of the teams where genetic counselors and then geneticists, medical doctors, and everything is on board. I'll just go through the team. So me and Dheeraj have started this venture 2 years back. My background is that I'm from the segment in genomics with 15 years of experience, and then we have almost 15 scientific, science background people, medical background people in the company, and they are leading the lab efforts and segments with around total size of the company is today 25. Last year, the revenue was, this is a still advisory team where we have quite a good name from the different segments from the human science. And these guys have really done wonderful job in their particular domains. This is a small lab which we have created out of Noida now. We have infrastructure which can take single gene to multi-gene and to the whole genome analysis. So we can start from any small diagnosis to the complex diagnosis, and we can deliver anything out of that. So DNA is something which we know, and that is what is our expertise. In last 1.5 years of the full operations and 1 year of the complete operations, we have just finished $1 million of the sales, closed our books last year. And now we are looking at, after, of course, the COVID has given us a lot of chances to think of new strategies and new developments, because we are in diagnostics, impacting human life every day. So mother and child is a stack which is giving us more opportunities and more excitement in the market. And after a small research in last 2 months during the COVID time, what we have come across is that if we create a tech platform which can support pregnancies, which can support a mother and child issues directly, we can reach out to many people, and that is what we are doing. The pivoting has given us the chance to reach out to multi-centric approach today. Krista, which is our mother and child brand, and one of the new entity, not out of the company, but as a brand name, has been loved by the gynecologists in the country. In last 3 months, I think we have reached out to more than 100 clinics and created a kind of impact where end-to-end solution is offered. We are trying to ensure that the person from pre-pregnancy to post-pregnancy to post-delivery is completely attended, and everything from the first scanning, from the first diagnostic experience to the consultation, everything is attended from our side. So it's kind of an end-to-end service platform which we are trying to create using the Krista in the pack. And there will be a tech platform, which is app basically coming up out of it, which will be having your personalized reporting and everything together. This is how our infrastructure and phases look like in the organizations. Our 2020 plan is to raise $20 million of sale, and today we are ramping up the same. And in next 1 month or two, we will have a team of 40 to 50 people on the job. In fact, half of the team is already started working on this, so we are good to go in this particular segment. Already crossed our first pre-series A, so we have raised around $1.5 million closed in last year, looking for around $5 million to go for a series A, and that's what the plan is, with a couple of guys around us. This is few tests which we offer in the company: carrier screening, clinical exam test, pregnancy test, which is NIPT, and oncology. We have only DNA-based diagnostic in oncology. Few of you must be knowing about them: solid cancer and hereditary cancer panels. That's all about us.
Okay, let us open the floor for question and answers.
Yeah.
Are the insurance companies paying for these services, all of them, or some of them, or is some of it part
Some of
patient
them,
paid
some
too?
of them, yes. Some of them, not all of them.
Is the majority of the 1 million revenue from insurance companies though?
No, it's a direct revenue. No. In cancer, a few of them are still taking the insurances, but in mother and child, it's not yet.
So who chooses to be tested? Is it the patient or the physician?
The physicians. It's a physician driven, and that's what is the another barrier for this business to grow. So I mean, we are trying to create a tech platform which may address this issue, where people can read and talk about it openly. And we are trying to create a virtual clinic model where our own doctors and our own physicians is available to discuss with the patients directly.
Okay, thanks.
What's the revenue model and basically unit revenue per customer?
Right. So so the entire journey from pre-pregnancy to the post-delivery, the revenue model is that we have different packages, which is designed in the consultation of the clinicians. And this is first trimester, second trimester, third trimester, based on their pregnancy journey. If you pick up the entire 3 trimester, it is around 50,000 rupees, which is how much? Like $1,000?
$800. Yeah.
$800.
Yeah.
It's a steal.
That's only for the diagnostics.
So you are generating revenue now? I wasn't sure.
Oh yeah, we are. So last year we closed at $1.5 million revenue.
Okay. Any plans to expand globally, or are you primarily focused on staying in India?
India is the first focus, and then we already have started operations in Middle East for some time, but because of COVID, we had to stop the expansions. So Middle East, the next one where we are.
So what's your value proposition? Because there's oncology and genomics and DNA.
See, I think, so genomics has been the value proposition before COVID, and it will remain in a core of our offerings. But because of the COVID, the market has been changing a lot, and now it's time, when we should create a technology platform where doctors and clinicians can, and physicians and patients can come together and openly discuss about their pregnancies and everything. So that's what we are doing. So I think for me, there are two value propositions here. One is the pregnancy, and another is whatever genomics is there. So genomics is, remain in the business.
Okay, guys. So I think we are done. So
Okay, so next we're
Yeah.
having Code
Thanks,
Connect.
Ashish. Yeah.
Thank you.
Mohammed, you're there?
Hello.
Mohammed, you're there?
Yes.
Okay, so you're ready to
It's
present?
Mohammed from Vodka Connect. Yes.
Yeah. So just for the judges and everyone connected on this call, Mohammed is from Egypt. He got connected with me on LinkedIn a couple of weeks back, and I thought this is a good opportunity to give him a platform to showcase a startup. So
My pleasure.
In fact, I should call him Dr. Mohammed. So Dr. Mohammed, please go ahead.
My pleasure. Actually, I'm glad to have you to be here with you and to have a chance to tell you more about Code Connect. Code Connect it's an online platform connecting health professionals to opportunities, educational, professional, and other healthcare related opportunities. Let me first take you through the pitch deck, then later I can take you through the products. Just a minute to share the screen, please. Now you can see the pitch deck, correct?
Yes.
Okay, so what is Code Connect? Code Connect is an online hub for healthcare, professional, and educational opportunities in the MENA region. We are, as the meantime, we are limited to the MENA region, but our services can be used. It's a totally online service. It can be used from all over the globe, but it's the first of its kind, especially here in the MENA region. What are we trying to do here? We are trying to build a multi-sided marketplace where providers can list their educational and professional opportunities and label it according to the professional criteria, like the professional specialty, medical degree, etc. And from the other side, the health professional can easily search, find, book, pay, and apply to the opportunity from the other side. So what is our problem here? We all know healthcare professionals are always busy. Medical networking happens only in closed groups, blogs, and forums. Suppliers are still using offline marketing and sales tools, while doctors are still finding jobs and booking medical courses, training, and conferences almost by the same methods they used in the 90s and 80s. This is what we are trying to change. This is why Code Connect is born. What is Code Connect? For our short-term plan, Code Connect, it's a product for events and jobs. By events here, we are talking about the educational opportunities, one place where you can find a medical course or a conference, either if it's online or offline, or another training or any other educational opportunity, or a job just like any other job finding platform, but more tailored to the healthcare industry. So what we are trying to do here is digitizing medical event booking and job finding, our main three value propositions at the meantime, with our live product, which is only the educational opportunity product, is the only module which is live now. We took it live last month. Is our three value propositions are search, book, and pay. Code Connect envisions to be the first of its kind networking platform exclusive for healthcare professionals and other stakeholders in the industry. We are trying to digitize medical networking through a multi-seller marketplace, specialized opportunity search through verified healthcare institutions. We all know about the total global healthcare market size. I'm not digging into that at the meantime, but the market we are tackling here is the global continuous medical education market, which accounts for $30 billion with compound annual growth rate 4.9%, and the global healthcare staffing market with $35 billion and compound annual growth rate of 6%. Our sum here is somewhere around 3.25 billion US dollars. We are as a multi-sided marketplace. Our users here are the healthcare professionals, everyone working in the health workforce, physicians, dentists, pharmacists, vet assistants, healthcare managers, therapists, etc. From the other side, who are our partners or the ones providing the opportunities are hospitals and the clinics, education institutes, real estate companies, medical labs, RADs, pharmaceutical companies, conference and expo organizers, recruitment and HR companies, etc. So what is our business model? Our business model here is a B2B and B2C business model. We are trying to have multiple revenue streams that will be differing from each module or each product. For example, our first product is the educational opportunity platform. It's a commission-based model. You don't have to pay anything, at least for the meantime, to list your opportunity on Code Connect. From the other side, if one booked your course or conference through Code Connect, we take a cut 15% gross. As the meantime, we are not letting them pay listing fees or subscriptions or sponsoring and ads. However, those are very expected by the end of this year or the beginning of the next year. Regarding the competition, we are competing with how things used to be. We are competing with non-professional products who our users sometimes try to use to solve similar problems, like posting about a medical training program on Facebook or something like that. You might meet an ad, you might be able to subscribe, but it's not a platform where you can filter and search for every specialty and subspecialty related opportunity. We are also directly competing with event booking websites like Eventus and Eventbrite, but they don't have any kind of vertical penetration. It's non-specialized. It's only for events as well. While Code Connect, it's for events for this module, but it's not for the long-term vision. It's not for events. Regarding other competitors like Doxamity is more about medical networking. It's only limited to physicians in the US and Canada, and it has nothing to do with events. So our unique value propositions here is that we are unique, we are exclusive, we are one-stop shop, we are easy to access, customized, and scalable. How are we going to reach our customers? Through targeted online ads, through conferences and events, and through direct sales. Here we are talking about the providers or the partners providing the opportunities. This is our team. I'm a single founder with early adopters, family and friend investors, Mr. Mohammed Al-Adi and Dr. Omar Dubea. Most of this team is coming from mixed business and medical backgrounds, except the technical team for sure. Our operation and commercial team is coming from healthcare background and business background as well, health insurance and pharma industry as well. What is the progress we have had so far? We have been live beta in January 2020. We were live with the first version of the website in March 2020. Since our first month, we have had some sales, but since we started in March, all the offline events have been cancelled, and all of what had happened due to COVID-19 and all of these things. However, by then we had around 25 providers and 75 events, and we made by this month. However, we started by the end of the second week of March, we made sales with around $700. In the next month, in April, we made with $3,000, and in May, Ramadan, which is not the best month for getting more traction or starting new educational programs. However, we have made sales with $1,200. We are still iterating the product. from multiple aspects regarding the user testing analysis. We are trying to research the market and the user behavior. What we have reached here, actually we are live. We have got some sales, but for sure we have not reached the profits stage yet. Those are our revenue projections. I will take you more through it after showing you the product first. What we are raising here is $2 million pre-seed round. Let me show you more about Vodka Connect, the website itself. We are talking here about a typical multi-sided marketplace, something like Booking.com or Airbnb, but it's not for hotels or it's not for booking accommodation, but it's for educational and professional opportunities. From here, you can select your profession. I can select that I'm a nurse, I'm a dentist, I'm a physician. I can select a specialty or more if I want, or I can search by keywords for certain program. Then I find the filters that are relevant to my search here. Let's take any program I try the process with it. This is CPHQ preparation exam course. It's here. It's a recorded course. It's not live. This we have just made this update a couple of days ago because we're not fully optimized for online events and courses. We were more optimized towards the offline events and courses because it constitutes more than 95% of the market. However, when things happened, everything went online. So we started optimizing our product more and more toward being more optimized toward the online offerings. Now you can see for each program, you can know if it's a recorded, a live, or on-site offline program. Let's go through the process here. For sure, this is a user-generated content. We offer digital marketing services for our partners, but we don't. It's not obligatory. So everyone can create a business page. We just approve that they are a verified medical institute. They can add their content, everything about the course or the event. They add the description, the target audience, the price, the number of tickets they need to add, and all of this. Then they can publish it. And from the other side, if I'm a pharmacist or a physician looking for something like this, I get matched automatically according to the search. Then I can go through it and poke.
Dr. Mohammed,
Yes.
I want to stop here because time is already up, but I still let, if anyone wants to ask a question. So
Yeah,
we can
sure,
take
sure.
one or two questions, yeah.
Okay, do you want me to continue this process? It's a normal checkout process here. Nothing is different about this. You can ask the questions if
I have
if you
a
want.
question. What
Yes,
is
sure.
your customer acquisition cost?
Our customer acquisition costs, actually now we are getting our providers through direct sales techniques, where we are getting our users typically through digital marketing activities. Our customer acquisition cost at the moment is exceeding $75. However, our lifetime value should be exceeding $200. However, for testing it for only a couple of months is not enough to get the right numbers or the accurate numbers. But so far, we are almost getting paying around $50 to $60 for every customer making a transaction. But the problem is, we are trying to work in and to build the infrastructure to make it more reliable, that you can find the events here with $200. and you can find other events with $30,000. So we cannot make our calculations as easy as that, especially when we are trying to build a marketplace, the first of its kind, especially that we are focused on education opportunities, but our long-term plan is not only being focused on educational opportunities and courses and conferences and all of this, but we want also to add jobs, internships, scholarships. We might even go for equipment, instruments, and other professional products and services. However, this is in a new model, not through the typical e-commerce model that everyone has tried before with no success rate.
Okay. Thanks, Mohammed. I think we have run out of time. So thanks for your presentation. Thanks for joining. Just stay on. So we'll move on to
Thanks a lot.
Harmony.
Yes, next one is our last one, Harmony.
Yeah, this is the last one. Yeah. Vidya, you're there?
Okay, it was very nice to talk to you all. Thanks a lot for letting me here. Thanks a lot. Thank you.
Sure. Thank you.
Goodbye.
Bye. Vidya, you're there?
Hi, can you hear me?
Yes, we can. So go ahead, start your presentation. Yeah.
Okay. It looks like another participant is still sharing, and I'm not able to share my screen yet.
Catherine, I think Mohammed is still sharing. Mohammed, can you stop sharing?
Yeah. Okay.
Go ahead, Vidya.
Okay. Hi, everyone. We're Harmony. We're a health and wellness app for teens and young adults. We all know about the unprecedented times that we're in and the impact that COVID has had on young families. So the $95 billion fitness industry has taken us.
Sorry, Vidya, can you make your slide deck full screen? We are partly seeing that.
Oh. So can you see my screen now?
We can see, but the slide is only partial. Can you make it full screen slide?
I'm on slideshow right now, so.
Okay, fair enough. Carry on. Maybe it's something to do with. Fair enough. Carry on.
Okay. All right. So we know about the times that we're in and the impact COVID has had on young families. The $94 billion fitness industry has taken a huge hit, and teens still strive for social validation, physical interaction, and lack of friendships in this time. So as moms of teens ourselves, Heather and I created Harmony to help teens and young adults to stay mentally and physically fit. Harmony is an app that nudges and motivates users to stay on track using a gamified approach that helps them level up based on the number of challenges that they take up and complete.
Sorry, Vidya.
Yeah.
I hate to stop you, but I don't think we can see your slides. Like your screen is sharing, but yeah, now we can see it. Okay. I'm sorry to interrupt. Just keep going.
Okay. Can you see my screen now?
Yes, now it's up here.
Okay. So Heather and I basically created Harmony to help teens and young adults stay mentally and physically fit. So Harmony is an app that nudges and motivates users to stay on track by completing challenges and level up based on the number of challenges they complete. So they also earn Harmony Bucks and other rewards that can be funded by parents and brands. And these nudges are personalized using our deep learning AI engine. So in a nutshell, users basically create challenges that help them earn different things. They earn experience points, they earn gems, they earn Harmony Bucks, and they earn a reward that can be customized. And these experience points and gems help them level up with a giveaway at each level that help them get a giveaway when they achieve each level. The Harmony bucks that they earn can also be used to buy gift cards or donate to a charity. So we soft launched Harmony with about 100 users in our community who provided feedback and helped us build the product and are helping us test the product before we go live. So we plan to go live with an Apple Watch integration by August 15th before the start of the school year. This will include physical fitness challenges like run, walk, bike, swim, and chores that can be created by the users or can be assigned by the parents. Our second phase would include mental fitness challenges that we plan to go live on September 30th. And this would include mental fitness challenges like eating right, hydrating, sleeping on time, driving better focus, and gratitude. Our biggest launch would be by the end of this year, where we plan to launch with community challenges and third-party apps. We all know that people and interaction has no substitute in our virtual world, and nothing can compensate the time that we spend with our friends and family. So we plan to bring in community challenges by our third phase, which will include leadership boards, joint goals, and working together, contributing to our community, but while making friends and also earning rewards. This will also include integration with third-party apps that will drive accountability for online learning and other tasks that they can complete. So we plan to achieve at least 1 million users by the end of this year. And Heather, my partner and CMO, would now walk you through our go-to-market plan to help this happen. Heather, on to you.
Yes. Let's see. Okay. Can you hear me?
Yeah, we can.
Yeah, we can.
Okay, perfect. I was just making sure. Hi, everyone. I won't take too much of your time. I know we're on a little crunch. My name is Heather Ruiz, and I'm the CMO for Harmony.ai. My background is over 15 years in sales and marketing. I've done McClatchy News, running Central California sales, and I've spearheaded marketing at 101thingstodo.com, as well as my own venture and hyper-local marketing with danvillesocial.com. So now I'm going to talk about the go-to-market plan with Harmony. We actually are in the works of working with, can you guys see that screen? Hold on, let me get it on here.
Heather, I'm sharing the screen.
Oh, okay. So we are going to start a Dance for Hope, and we're hoping to go ahead and partner with NBA franchises and players. We're actually in the process of communicating with one of the NBA's former Seattle basketball player, Gary Payton. He lives locally here in Danville, and we also have other players we're working with. And this one, it's going to be a fitness fundraiser similar to what Lady Gaga did with the One World concert for Black Lives Matter. We all know that the TikTok dance videos are popular right now with the teens. So we're hoping that this is just going to take off, especially with the TikTok and all of the different workouts everyone can do. And then we're going to get the celebrities and guests and promote it on social media to fundraise for charities. We're getting communities, clubs, school, universities, and brands that can form dance teams and work out and compete. So we are working on that. And then also, let me get this one up. Our target market, is that slide up here? Let me get that one. There we go. So we have 100 counties with about 100K average and HHI, and then about 60 million population and 20 million households. The market opportunity is $2 trillion. Median age, about 40 years younger and then 40% of the US population and Gen Z. So basically, this is something we need right now. The kids are always on their devices. They're constantly on apps, and we know because we have teenagers, and this is something that they will definitely love and ready to download. And once we get all these competitions going in and charities, and we give them benefits for, you know, staying healthy and well, and just we're, you know, promoting for them to have a healthy lifestyle. Okay, Vidya.
Yeah, thank you. So just looking at what we think we can achieve. Every user in the US, every teen has about $150 in monthly allowances that they receive. So the funds that we expect to get in the digital wallet per year is about 1.8 billion. So our key business model is to drive revenue using subscriptions for premium plans that will come up in the future in our third phase, and also through e-commerce and ads. As you can see here, we expect them to spend less than 10% on e-commerce in the store that will be available. That will drive a revenue of 12 million in net. And we also hope to be able to get at least 20% of the users subscribed to premium, which would drive about $18 million in revenue, given that we will charge about $60 per family for them to subscribe to premium, and generate about $10 per user in ad revenue in a year. So that basically just summarizes our plan of what our net revenue would be in a year. And our ask at this time is for $500K to help us complete the development and our future fitness content, because we have already developed the apps, like I said, and are testing out the physical fitness part of it. But we still have some development to go with integrating with third-party apps in the mental fitness part of it. And marketing can be expensive, as you can see, and to develop the AI deep learning personalized nudge engine that would help us customize this for all users. Thank you.
So I have a question here. Okay, so I think it's a great effort. I think it's a wonderful, love the story here. But how are you going to make sure that people are doing the activities that they claim they are doing, and you know, trying to on those points?
So we basically track motion and fitness. So for all the physical activities that are completed as part of our first phase, it is all trackable. So if they create a run or bike app, so we connect to the motion and fitness to be able to, you know, validate that they've completed that activity. When it comes to chores, things are extremely custom. So these activities would be sent to their parents for approval, and the parents would have to approve that they have actually completed the activity, because chores are typically funded by parents. And they would have to validate that this has been completed and provide them the Harmony Bucks and rewards that they earn.
Have you done any early tests to see that this is sticking with people?
So we have a focus group with about 100 families, and our app by itself includes both standard tasks and creating their own tasks. So we have created the standard challenges based on the feedback that we've received, and we have taken their you know, input in place to build the app itself, and we have received great feedback so far. And we plan to increase our focus group both with teens and with parents, and test it before we go live.
How big is your team right now?
Count, my partner who handles operations, can answer that question, but we have a team in India which has about 20 people, including social media marketing and development activities. Some of them are freelancers and some of them are full-time with us.
How are you funded right now?
We did a family and friends funding. We invested our own money to start with, a lot of it. And we did a small round of family and friends for about 5% of the company. And that's how we have completed our development so far.
Thank you.
Okay, Vidya, can you stop slide sharing? So quick question, right? You're a wallet. So are you tied up with some bank or something to run this whole thing in the backend?
So we approached a few challenger banks who asked for about at least 10,000 users before they can partner with us and integrate it with the bank. So as you can see in our first phase, as we hear from parents, they're not so worried about the transfer of funds itself, but it is to motivate their kids to be on track and to complete those activities which are customized. So, which is why we have gift cards, which the parents can put in their bank information. We have integrated with Plaid to integrate with their existing bank accounts where they can purchase the gift cards for the kids. But we plan to integrate with banks as a digital wallet in the future.
Okay, thanks. Any more questions?
Do you see the wallet approach as a barrier to entry versus a straightforward subscription-based model? You download the app on your Apple iWatch, you hook it up with your iPhone, you basically pay for it on a pay-as-you-go basis or annual subscription. When the wallet is a barrier to entry because there will be hesitation on the part of an average customer to sign up and integrate with their banking information. That typically is a big barrier. Have you So what's your thoughts on that?
So we, our onboarding includes ask them to integrate with a bank, but we let them skip it if they're not comfortable with doing that. So if they do not integrate with a bank, they still continue to earn experience points and gems. That helps them level up and earn giveaways. But if they typically have to make a purchase through the app, the parents, and earn Harmony Bucks, they would have to have their parents sign up with a bank. So we still let them use the app and use it as a gamified platform that helps them complete certain tasks. But to make a purchase, we still ask them to integrate with an app, with a bank. So we do not see that as a barrier because at this time, we're just integrating with Plaid and we're not storing their bank account information ourselves. And we're letting the transaction happen smoothly.
What's the revenue strategy for Apple Watch integration? Because that's a huge play. I mean, have you been given a go ahead and are you certified now to actually integrate with the next launch for the software upgrade on the Apple Watch?
Yes, we have been given a go ahead, and we are currently done integrating with the Apple Watch as part of our development. We just have to do the testing part of it. So we do not expect to have a revenue using the Apple Watch yet. As I said, our initial revenue model is to only get subscriptions and e-commerce happening at this time. But that could be something that we can look at in the future.
Okay. And are you prepared to share 30% of the revenue with Google Play Store as well as the Apple Play Store, Apple App Store for the first 12 months of your business? That's their model. You know that, right? So.
Yes, we like I said, we still own the chunk of Harmony, so we are willing to share it, when it comes to that.
Okay. Thanks.
Okay. All right. Thank you.
Thanks, Vidya.
Thank you.
Any more questions or?
Yeah.
Okay. Go ahead.
How long do you think your 500K will last you, and what will your next fundraise be?
Our 500K should last us till the end of this year, which is our plan. Our plan is to, go live by the end of this year with a typical $1 million, 1 million users, and all of the features that we want at this time. So our hope is to be able to make the money with our go-to-market plan and see how that goes. And if it doesn't launch as fast as we need to, then we will have to plan for a second fundraising effort. But we hope to not be there at this time because we've received great feedback. We have approached PTAs of the local schools, and we plan to approach the PTAs of all the school districts in this country and partner with them to get the kids to download the app and for parents to use the digital parenting part of it.
Great, thanks.
Okay, thanks. Thanks, Vidya. So just everybody stay on. So I just want to quickly take one round with all the judges. Your last thoughts, parting thoughts for all the founders who are here on the call. So we had a great session. We had great pitches. Just your last thoughts for founders. Barbara, you're on the top. Let's start with you.
All right. I think everyone did a great job. Some of you were better with their slides in terms of giving us the information that we needed in a concise method. I would urge you to practice with less slides, especially in a format like this where you don't have very much time, to really hone in on the take note of the questions you got, to hone in on some of those questions and address them in your slides in a very succinct way. And those of you who did not have your name on the slide, you should have it. I think one of you, I can't remember who, didn't have the name of your company on each slide so that it reinforces who is speaking. But in all, it was very interesting, and I'll put my comments to each in an email to you, Pavan, and you can forward to them all.
Thanks.
Thank you.
Thanks, Barbara. Peter?
So unfortunately, I missed a couple of the initial presentations through a technical problem, but I heard 4 of them. So I think people did a good job of telling their story, but some of the slides were very, very hard to read with much too much information on them. Even if we weren't in this Zoom format, even if you were projecting in a conference room, there's too much information there. And I think only a few of the people talked about the competition, which I think is an important thing to deal with in the presentations.
Okay, thanks, Peter. James?
Yeah, I was thinking everybody did a good job, but in this format with the time frame, like the 5 minutes and then the 5 minutes for questions, a lot of people almost took the whole time to do their presentation. So maybe better time management with that. And just in their 5 minutes, you're saying, why this, why them, and why now? And then they basically get the questions from the judges and get the feedback there. And then when they're asked a question, just to give a more concise answer, because some people just kept going on and even started showing more slides when they're being asked questions.
Okay, thanks, James. Debbie? You're muted, Debbie.
Okay, I concur with the previous comments, and also make sure that when you start, you say what your business is. At least half of you didn't do that. And we had to infer what your business was. And particularly in a short time period, don't do what's called burying the lead, okay? Say what your business is about. And it never hurts to give a very top line summary of where you are so that we can keep that in mind as we listen to your slides. I do think that some of the presentations were really quite well done considering how early you are. And I also feel an obligation in this particular moment. I know many of you are not from the US, but surely you're aware of some of the...
Again, you're muted.
Sorry. I'm surely you're aware of some of the societal upheavals in the United States and around the world. And I would just suggest that you try to be cognizant of the fact that, for example, showing a slide of all men as your team, or perhaps addressing a product that is very much a 1% product. I mean, that's a perfectly reasonable business thing to do, but you might in your presentation try to at least not acknowledge the fact that you're doing something that's for a very limited audience, and even think among your team, okay, is there a way that we can try to take the approach that we have and use it to address some of the kinds of issues that have been raised over the last couple of months.
Thanks, Debbie. Sudhir? You're muted, Sudhir.
Yeah. So great presentations. I think, I would not say that all of them were great. So when I look at such a presentation, what I'm looking is for four things. What is a team? Because team is the most important thing for me. Okay, most of the startups are very early and pre-launch stage startups. Okay, so for me, the team, the entrepreneur, how he thinks, how he's able to transform an idea into business is very critical. I saw a lot of them were focusing on the product itself. This is not a product presentation. This is an investor presentation. Okay, so my take homes always are in terms of what is your team, what is your technology or the idea, what is your timing, is this the right timing and why is it now? I think somebody said earlier, right? Why now? And finally, what is the traction that you have been able to achieve? The traction need not be in terms of acquiring customers. It could also be in terms of progress of your product. But what's the traction and in what time frame have you achieved this? I think those are very critical things for me. I think a lot of them drowned us with too many slides and too much description of the product. Particularly, I would like to say that I really liked one startup which is Ratcliffe. Okay, but he had such tiny fonts over there. Even with my pair of glasses that allows me to see magnifying fonts, I could not see anything there. But that is a good startup too.
Right. Okay. Great. Thanks, Udit. John?
Yeah, good
John,
good
you're
pitches.
muted.
Yeah, can you hear me? Hello?
Yeah, we can hear you.
Okay. Yeah, good pitches.
I
Like
think we missed
Peter.
you in the beginning. You came in.
Yeah, I'm sorry. I had some. I ended up having a personal conflict, so I apologize for missing some of these pitches at the beginning. But I saw, I think, 5. I second some of the good pitches. I second some of the comments. Some of these startups speak too much about their product, and they should speak more about their team and their traction, whatever. I see lots of pitches. Most people cover everything. What the good pitches convince me or convince investors that what they're doing is inevitable. Like it's like it's gonna be big and it's gonna be inevitable, and then it's like we the right team, right? Somehow you get to you have to get investors to set aside the fact that these are very high risk propositions and many of these startups are not going to make it, and like can suspend belief, and somehow, and there's different ways that people have either by logic or by emotion, whatever, but they convince us investors that this is just going to happen. It's going to be big. That's what makes a great pitch.
Right. Thanks, John. Saeed? Saeed, you're muted.
Yeah. So overall, some like people said, some very good pitches, some not good, some barely made it. Overall, I think a lot of people were some of them were actually pretty nervous. Some of them were taking quite a long time on slides, which really didn't matter in this presentation. I think the point that everybody should adhere to, and this is just a feedback from all of the work that I do across all of the startups, is present your story at the first slide. What's the business that you're into? Why is it important for your customers? What will drive them to come to you and actually write you a check or swipe a credit card to pay you? What are the pains that you're alleviating? Why is it that you matter? How much money will you generate immediately? And then what's the plan to generate revenue? If you have anything big like an Apple integration, bring it up in your first slide, not wait for the 15th slide to bring it up. So stuff like that is important. And so that's my feedback. I think it's a great effort by everybody. It's very hard, very tough to actually pitch in this format. So you got to give them credit for that. All right, thank you.
Absolutely. So I think we had a great session. My thoughts as an investor, everybody did a great job. Again, the founders want to deliver a lot of things in one session. I think you should always believe or also remember that investor does not write a check in one session. It happens over a couple of sessions or over a period. So the first session, if you keep it just to convince him that he's going to bank a great team and also a great idea, then you have achieved the first milestone. I think that really matters, how you build that sort of synergy with the investor, and also tell your story which convinces him. Then you can go get into more deeper engagements, get diving more deeper into products, what patents you have, how you are different, and all that. So that really helps. And also it is a very important, like we kept repeating, this is 10 minutes, try to keep it for 5 minutes, because what is more important is to also hear how much of your content has been understood in the right way by the investors on the other side. So if you keep more time for investors to interact, then you'll be able to clarify or at least get convinced that you have done a good job in communicating. So great things. I mean, every pitch is an improvisation. We all went through it. I as a founder, everybody in the judges panel is an ex-entrepreneur, or they continue to be associated with entrepreneurship. So these are all very positive feedbacks. Just take it in a very positive way. We also get told like what we did wrong, what we did right. So someone would definitely tell me after this session that maybe I was blabbering too long and I didn't keep the time well. So all this happens. So all of us are learning every day. So we should take it in a positive way. So thanks everyone. And I have requested judges to spend some time, write a line about each startup. And once I have that, I'll share with all of you. And we are going to run a summary of all this entire session tomorrow again. We are going to live stream it. We want to give one more chance to showcase all of you. So great job. I mean, great work, great startup ideas. Keep going, I mean, it just takes one bit of doing the right thing to cross the bridge. So all the best, and thank you, everyone. Just to conclude, right, this live stream continues. We have a couple of sessions coming up. We have a mentor bootcamp where all our experienced mentors from F50 Elevate have put together some nice videos which are very useful for the startups, whether you are early stage, late stage. It's very good to understand, listen, watch those videos, try to see how you can apply them during the COVID times. And I also put a video based on my own book, which is very relevant for the early stage startups. So do continue to watch these sessions. And then we have F50 cohort 1 startups which graduated in December. They are pitching. They have done some nice pitches, and those will be showcased now. And we are also showcasing 2 startups which have disrupted the health tech space in imaging as well as surgical place. So please don't miss the rest of the sessions. Continue to watch this. And Catherine has done a lot of work on this, and she'll continue to hold the session. So Catherine, what do you want to say in the end?
It's just for the startups because we have a mentor bootcamp coming up. So if you're interested in like what mentors having opinions on the current marketing and current funding in this specific environment, so just stay and I'll play the video through my laptop, and it's also on our YouTube SVE YouTube channel, and I will put the link in the chat box.
Thanks, Catherine. I think we'll end the session here. Thanks everyone. Thank you. Have a great day. Okay, bye-bye.
Thank you.
And just let me paste the link here. Okay. So for everyone else, I know you guys are pretty late in your local time. So if you don't want to stay and watch the video, you can just go to our YouTube channel and watch it there. It's pre-recorded now. but I'm gonna just play it right here as well.